You're watching The Source on CNN Philippines. The government has decided who will get the first dose of the COVID-19 vaccine among frontliners. Philippine General Hospital Director Dr. Gerardo Legaspi says PGH spokesperson Jonas del Rosario will get the first dose. Health workers who work at COVID wards will follow del Rosario. Dr. Legaspi says over 5,000 PGH employees expressed intent to get vaccinated. The goal is to have zero wastage of vaccines. Let's go straight to the source of the story, PGH spokesperson Dr. Jonas del Rosario. Good morning, doctor, and thank you for joining us.
Good morning, Ruth, and to your televiewers.
Doctor, you were named as the first one to receive the first vaccine. Sabi ni presidential spokesperson Harry Roque, you will be part of history. How does this make you feel? What does this mean for you?
In a way, it's just probably just a symbolic gesture, but being one of the frontliners of PGH, there are others who are probably more deserving now because, I had COVID-19 and in some ways I have some immunity. But they identified me as someone though that can probably represent the frontliners who had a significant experience with COVID and partly quite affected by it.
Mm-hmm. Can you tell us more about what you went through lang, doctor, about yung experience nyo with having COVID-19 and then also I think with your family, with how it has affected your family? Mm-hmm.
I actually tested twice for COVID, tested positive. Initially, sometime in the first week of April, I was asymptomatic, but we were swabbed as part of a contact tracing, and I was positive, and so I got admitted initially in PGH again, and then when I tested negative, I was cleared. So that was my first taste of being a COVID-19 patient. Luckily, that was really uneventful. But then in July 28, I again experienced difficulty of breathing, and fever and headache, and so I again got admitted to PGH, this time full-blown COVID-19 pneumonia. So I was hospitalized for 2 weeks.
Mm-hmm. And then how did this make you feel po? And then now that, what will this mean for you and for the rest of the frontliners, especially in PGH? Kasi si Director Legaspi was saying yesterday that hindi pa ho lahat are willing to get vaccinated.
Right. In a way, I wanted to tell our frontliners, especially those working in PGH, that the vaccine is here. It is not a perfect vaccine. I mean, the effectiveness is still untested. We have the efficacy of 95% at least to prevent severe disease. So I will gladly take it, even just for the first dose to encourage others to take it also. Yes, it is. We're lucky in a way that PGH was chosen to be the first institution. Anyway, there are also other hospitals which will follow suit. In general, most of our healthcare workers, employees are anticipating this vaccination. We had a heavy turnout. Initially, we thought only about 75% of our health force will be for the vaccination. But in the 3 days that we had our registration and screening, it was close to about 93% of our workforce will be getting the vaccine.
Do you already know the initial date of the vaccination? Because like yung first batch dapat ng Pfizer, the government announced there would be a delay, and then we will probably expect the Sinovac vaccines by February 23, according to Secretary Roque. Sa PGH po.
We don't know yet, Ruth. Initially, we thought it's going to be February 15, but just probably what you heard in the news, there will be some delay. So we're just really waiting for the final announcement. No? But in the meantime, we're really doing all the necessary preparations from the simulation exercises that was done to now. Yesterday, we had also some simulation exercises in the actual vaccination. We will rehearse a few more times just to make the procedure seamless and efficient.
But you were already mentioning the simulations. What are the challenges that you saw during the times that you had the simulation?
A few challenges will include crowd control, making sure that we still maintain physical distancing. The second challenge is to make sure that the vaccine itself is well protected, that the cold chain is not compromised. And thirdly is the actual vaccination itself, that the vaccinators will be able to get the most out of the vaccine, that there will be no wastage, and on the in the and for the vaccinees to make sure that they are prepared and then to be monitored properly after the inoculation for at least about 15 to 30 minutes.
Okay, we're all looking forward to that. Thank you very much to PGH spokesperson Dr. Jonas del Rosario. And thank you for joining us here on The Source. I'm Ruth Cabal. You're watching CNN Philippines.